We are the affirmative side of the topic on should African nation make genetic counseling service free and accessible to reduce the stigma associated with genetic disorder. I am Irkalam Tola from Ethiopia, and my friend is from Kenya, Kitur Kennedy. So I will be presenting the introduction part and the opening statement as well as the argument side, and my friend is going to represent the rebuttal and the closing statement part. So, introduction: genetic disorder like sickle cell disease, thalassemia, hemophilia, and congenital anomalies affects millions in Africa, and the stigma associated with genetic disorder is mainly driven by misinformation and cultural beliefs that leads to blame, secrecy, and social exclusion, what we call it as social disease. So, making genetic counseling free and accessible for African nation is a must thing because genetic counseling is a health service that provides accurate information so that individuals can make informed decision making that will support their decision. However, the access is very limited in Africa due to many factors, especially due to cost and other social related factors. So, in our opening statement, we would like to say that African nations should make genetic counseling free and accessible in order to reduce stigma that is associated with genetic disorder. You say yes. Why? Because genetic counseling is one, it is a public health necessity. The other, it must be free and accessible service so we can reduce stigma associated with the genetic disorder. The other, it supports universal health coverage, social equity. The other is it improves early diagnosis so that we can do on prevention of genetic disorder and the cost minimization so that have economical benefit. So coming to our constructive arguments, the first argument we want to raise is making genetic counseling service free and accessible in Africa is important in reducing stigma. Stigma thrives where ignorance and misinformation exists. So, genetic counseling explains the biological causes of genetic disorder, and so that the nations in Africa will not consider it as a curse or will not associate it with divine power. The other is it also reduces the blame on women. Most of the time, if an individual or a person have genetic disorder, especially of children, women take the blame. Women are the scapegoat. So genetic counseling, making it free and accessible, will reduce the blame on women and families. The other is it improves social acceptance by tackling the misinformation and the ignorance. We can improve those with genetic disorder to have social acceptance. This all is supported by World Health Organization because WHO, World Health Organization, supports genetic education to reduce discrimination. The second argument we want to bring on the table is that health equity perspective. Making it free and accessible is one of the health equity issue. So most African nations are excluded from genetic counseling and genetic related services because of cost. Cost excludes rural and poorer population. We know most Africans affected by genetic disorder live in low income households. This affects the principle of upholding health equity. So this increases inequality. So we need to make genetic counseling free and accessible. that aligns with universal health coverage and the Sustainable Development Goal 3, which states that good health and well-being for everyone by 2030. The other is we can make it, that means genetic counseling integrated into primary health care so that we can improve the service accessibility from the perspective of health equity. The third argument we want to bring is that making genetic counseling free and accessible is cost-wise, it is very effective. It prevents complication and long-term costs. It reduces hospital admission. It